Okay, students, look at the question on the screen. What is good? No? What is good? In fact, as nurses, we are always oriented that we should do good to our patient. The principle that we apply is that we do good to our patient. This principle that I am referring to is actually the principle of your beneficence. This is the principle of beneficence. So class Magambal, when we say what is good, we are answering on the principle of beneficence. Okay? Now, the question in ethics is as simple as what is good, but the situation that you will encounter in the clinical setting is not simply good or bad. Okay? Now, try these examples. What would you do? Would you make your patient live or will you kill your patient? Sige nga, could I see answers on chat? Would you want your patient to live or will you kill your patient?
Live.
Live, di ba? Obviously, sir, naging nurse nga ako para nga makatulong sa patient, di ba? So I would want my patient to live. But picture this example. If you are taking care, guys, of a patient with cancer, one of the problem of a patient with cancer is what you refer to as cancer pain. Okay? Cancer pain. Class, they say that cancer pain is among the most painful the most painful diseases that you can experience. Especially, guys, if the cancer would radiate or if the cancer would already be in what part of the body? Sa palagay nyo, which part of the body na very painful siya? Again?
Bone, sir.
Okay, very good. Plus, once the cancer has already metastasized, once the cancer has already traveled to your bone, very painful on the part of the patient. Now, one of the interventions that we give to alleviate, when I say alleviate, that means we would want to decrease the pain of your patient. Okay, one of the medications that we give is what you refer to as your morphine sulfate. One of the medications that you give is your morphine sulfate. Now, class, morphine is a very good pain agent. On the other hand, siguro you've heard of morphine, that it is also an addicting drug. But in nursing or in medicine, our concern is that morphine causes respiratory depression. Side effect of morphine is respiratory depression. Oh, look at this. Patient shouting because of cancer pain. Then I am telling you, one of the intervention is morphine sulfate. But then one side effect of morphine sulfate is respiratory depression. This goes back to that question, what do you want to do to your patient? Do you want them to live or do you want them to die? Come to think, cancer pain siya, if I will be giving morphine sulfate tapos respiratory depression, what would be the outcome? The patient will still die. Diba? Now, so in that essence, guys, with that example, you are reminded that it's not only the principle of beneficence that we apply. We also have, students, the principle of autonomy. We also have the principle of autonomy. In other words, we allow the patient to decide. Because when I say autonomy, what's autonomy, guys? The power for self-determination. Take note, your autonomy is the right to self-determination. When I say right to self-determination, the patient would have the right to. Mambal siya, no? For example, the patient would say, I would want to die peacefully. If the patient would want to die peacefully, then you can give morphine. Because at the end of the day, the patient does not want to die shouting for pain. But if the patient would say, I would want to experience the pain until my death, okay, then you know that you would not be giving morphine. Okay, so take note that in bioethics, we are using several principles in order to guide us in the interventions for our patients. Later on, guys, you will also know that there are set of questions, no? There are set of questions that we need to ask. And the bottom line of these questions is to determine whether the benefits outweigh the risk. Again, for you to know what is morally good, it needs to be that the benefits outweigh the risk. In that example of cancer pain, plus take note, your nursing interventions begin from womb to tomb. In other words, from the time that the child is still unborn until the time that the patient would die. Okay, your nursing interventions would be there. Now, plus one of your nursing intervention is to assist our patient towards peaceful death. Okay, one of your nursing intervention is to assist your patient towards peaceful death. In other words, by the time that the patient decided she's ready to die, one of the things that you can do is carry out the order for morphine, because that would allow your patient to have peaceful and dignified death. Okay, that would allow your patient to have peaceful and dignified death. Okay, those are some of the encounters that you will have in the clinical setting. Now, what is good? Our lolos and lolas, your lolo Plato and Aristotle has offered us some answers, no? But according to Plato, you know Plato, the philosopher, he said that there is a single form of good and virtue. So for him, okay, nag-iisa lang talaga ang good and virtue. But for Aristotle, who was also a student of Plato, he said that there are multiple virtues of varying degrees. So according to Aristotle, one could not be said to be good and bad, but there are several levels of virtues. Okay, there are several levels of being good, there are several levels of being bad. It's not about being one, no? And if you would look at the recent ethics, no, we are oftentimes inclined on the idea of Aristotle. Now, it also says here that the virtues or the values that you have can be actually acquired to the practice of habit. Okay? The virtues can be acquired to the practice of habit. This is plus actually contrary to the usual notion in education or in learning. We oftentimes say that knowledge comes first, then with knowledge comes attitude, and then with attitude comes practice. This is what actually Gregorio is telling us. No? Gregorio is an author which tells us that knowledge precedes attitude, then attitude could possibly trigger practice. But look at this. The idea of Aristotle is telling us that practice or habit would actually be leading towards attitude. Okay, practice and habit will be leading towards attitude. If you will be asking me, sir, who is correct, that idea of Gregorio or that idea of Plato, there's no actually answer to that. Okay, that's why we refer to these people as theories, because this is not solidly proven. This is not applicable in all cases, and then it would vary from time to time. But the definition of Aristotle, which says that attitude comes from practice, reminds us, okay, that nursing, for example, nursing class is a profession, as you have been taught. So class, for example, nursing as a profession is oftentimes referred to as a science and what's the other one? Science and nursing as a profession is both a science and an art. An art. So class, look at the word art. Plus the word art there tells us that our constant practice or habit makes our attitude or develops our attitude. Okay? That's why oftentimes I would tell the students, if you are a first-year student and you don't love nursing, you still have a very big opportunity to love nursing. But if you are already a third-year student and you still don't love nursing, it will be difficult for you to progress in the profession. It's difficult for you to progress in the profession. So kindly take note of that. No? So constant practice makes it your attitude. So for example, if it's my practice that if my patient will call, I will right away run to my patient, because that's how it should be. Next thing you know, class, the next month, it's already your instinct. Next thing you know, it's already your value. Okay, it's already your value because you're constantly practicing it. Now, what is good, no? According again to Aristotle's Nicomachean Ethics, so I've searched about this, and then Nicomachus is actually the son of Aristotle. That's why it's referred to as Nicomachean Ethics. So he's talking here about the goodness in the moral world for him, allows for degrees, levels, and differences. In other words, what might be good for Marco might not be good for me. What might be good for Karil here might not be good for Chiris, because each of us has different values. No? Or for example, if you will encounter a patient class who would have more value on dignified death, you would understand she does not want pain. But if you have a patient who value more of sacrifice, they might be saying, I want pain to death, because in pain there's sacrifice. Okay? Those differences could occur. So kindly take note of that. Huh? And that is what Aristotle is trying us to focus. Now look at these words. No? The sense of good or the good of man can be understood not only on how the said good affects himself, but also with those around him, since man is a political animal. If you would take my word here, I would not agree that man is just an animal, but that's not the main point of Aristotle. Aristotle is telling us that man has an inclination to be political. When I say here, guys, political, his main point is that we are not living as an island. We are not living as an island. So for me to understand what is good, I would want to know what are the reactions of other people? What are their perceptions about this? What are their ideas about this? And that would help me determine what is good. That would help me determine what is good. Okay? So it can be understood not only by looking at the effects to himself, but also those around him. Because after all, we are political. We are not only concerned of ourselves, but we are also concerned of how other people sees us. Okay? Now, in our nursing practice, this is also one way for you to understand, guys, no? One way for you also to understand that the culture has very much bearing on what is good for an individual. Again, the culture has a very big bearing on what is good for an individual. What do I mean by that? For example, if you're living here in the city, or maybe if you're living already in civilized organism or civilized community, you know that after giving birth, you need to take a bath. After giving birth, ladies, gentlemen, to your wives later on, they need to take a bath after giving birth. Within the day, they can actually take a bath. Now, go to the GIDA areas. When I say GIDA, geographically isolated and depressed areas, no? Or geographically isolated areas, you will notice there are people who are not taking a bath within 1 to 2 weeks after giving birth. Because for them, it's sacred to take care of the body. Do not bath the body because the body is sacred and the body needs to experience that of the womanhood. Okay? That's their value. That's their value. But later on, you know as a nurse that that would increase the risk for postpartum infection. Okay? That increases the risk for postpartum infection. But you also understand that you are not there to judge them. Okay? You are not there to tell them na, these people from this barangay are people who are dirty. No, that's not how you treat them. But you understand that this concern of theirs is already deep-rooted. Because as political beings, they are just receiving what their old civilization has transmitted to them, and they are trying to maintain their norms and values. Okay? That's why you need to understand them. Okay, understand. And then after all, mahambal ka, wow, ang hirap naman itong i-educate. Okay, they're very challenging to educate. Now, according to him also, aside from the existing degrees class, levels and differences, okay, the senses of good can be understood in an empirical manner. Plus, when I say empirical manner, if you would look at your definitions in statistics, and then if you would look at your definition also in research, when I say class empirics, meaning it could be observed. Empirics class, when I say empirics, it could be observed. Other than it could be observed, it could also be measured. Okay? It could be observed, it could also be measured. Observed and measured. Now, class, if something could be observed, something could be measured, look at the 5 words there. Seen, heard, touched, taste, and felt. That refers back to your 5 senses. That refers back to your 5 senses. Okay? So for us to say that something is good, for us to determine whether something is good, according to Aristotle, a morally good act should be able to seen, heard, touched, be tasted, and felt. Okay? What do we mean by that? If we are giving, for example, care to our patients, we need to have your therapeutic touch. Okay? Oftentimes we do your therapeutic touch. Guys, when I say therapeutic touch, this refers to a respectful touch to an individual patient. For example, you would just touch the hand of your patient and then tell your patient, Ma'am, I'm here. Okay? Notice the class, I did not say, Ma'am, don't worry, I'm here. Okay? In nursing, it is not therapeutic for us to say, do not worry. Because if you will be saying, do not worry, you are removing the feelings of your patient. Okay? You can just say, Ma'am, I am here. Okay? For example, if your friend is crying, it is not best actually for you to say, friend, it's okay. Everybody is experiencing that. That's not therapeutic, right? That's not therapeutic. The best thing actually for you to say to your friend is that, my dear friend, if you are ready to talk, I'm here. Okay? I'm here just to accompany you. Okay? If your friend is crying, guys, you don't actually need to cry with your friend. Huh? Okay? But if you would want to cry, I would not stop you because that's your friend. But if you're dealing with your patients, it's best for you not to cry to your patients. Okay? Let's have a little side topic. Guys, in nursing, what is actually recommended is for you to have empathy and not sympathy. Again, guys, what is recommended is for you to have empathy, not sympathy. Why? Sympathy, guys, is crying for your patient. Sympathy is crying with your patient. Whereas empathy is putting yourself on another's shoes. Again, sympathy, guys, you just write on the side, crying with the patient. Whereas plus when I say empathy, you're trying to place your foot in another's shoes. In other words, I'm trying to understand where you're coming from. So what are the empathetic words? You can say, I understand where you are coming from. By the time you will say, Ma'am, don't worry, I have been through the same. Pag gano'n ang hugot mo, sinong focus dito? Ikaw or ang patient? You're making the focus about you. Tapos the patient will say, oh, kawawa ka naman. Okay? You're diverting the focus, and that's not recommended in our practice. Okay? So your lines would be just like, I understand where you're coming from. Okay? But you could not say, Ma'am, I am also an abused woman. Okay? You don't say things like that. That would not be therapeutic. Now, let's go back to the empirical manner. So class, when we do things for our patient, it should be seen. It should be seen. For example, if your patient has fever, in fundamentals of nursing, if your patient has fever, what would be your intervention? If your patient has fever, what would be your intervention, students? Sige na, what are your interventions if your patient class is having fever? In a moment of silence, you can actually chat your answers. What would you do if your patient is having fever? Sige na, we should know this. We have been through fundamentals of nursing na. What would you do? Ay, hindi tayo aalis dyan pag hindi kayo mag-respond. What would you do? Okay? TSB, very good. Okay, you do your TSB. Huh? So you do your tepid sponge bath. Okay? Now, class, if you would look at tepid sponge bath, that can be seen, that can be felt by your patient. Okay, that's one intervention that you could do. And then after that, later on, class, after your TSB, what would you do? After the TSB, what would be your intervention for you to determine that your intervention was effective? How would you know that your intervention was effective? What would you do, guys?
Check the vital signs, sir, the temperature.
Very good. You recheck the temperature. And plus, the rechecking of temperature is actually an empirical evidence that you have done something good to your patient. Okay? That you have done something good to your patient. Okay? That's how it is for an act to become morally good according to Aristotle and also according to our practice. Now look at this example. Picture, class, that you have a patient, the fever is 39.6 degrees Celsius. You are a good nurse. No? You perceive yourself, I am a magaling na nurse. So you did your TSB. And then class, you did not recheck. After 1 hour, the mother was shouting because the child is already having seizures. So class, when I say seizures, these are convulsions. And this could happen to the child with uncontrolled fever. Were you able to do something morally good or not? Hindi. Okay? You only did TSB, but the outcomes of your TSB was not effective. So if you are a good nurse, supposedly, no? If you are a good nurse and you've done it correctly, after you've rechecked plus the temperature, and then you've noticed, oops, the temperature is 40 degrees Celsius. Even if I have done TSB, you need to inform the physician right away. You need to inform the doctor right away, and then the doctor might be able to prescribe medications. Now the doctor might be able to prescribe medications that could help your patient. Okay? Because a morally good nurse would understand that it is not only her who could be able to help the patient. You need an entire team for you to help the patient. Okay? That's what we meant by empirical manner. So hindi pwede na I did good because I thought it was good. Okay? Basta sa nursing, when you say akala ko, abi ko, okay, I thought, that's a big mistake. Ha? That's a big mistake. Wala kita sang abi-abi mo, hindi pwedeng akala-akala mo lang dito kasi you're dealing with the lives of your patient. Now, next thing, all forms of good actions seek happiness. Okay? According to him, all forms of good action that would seek happiness. So the bottom line, class, is that you do good. That goes back to the principle of your beneficence. And then, class, there's another one. Another principle is your do no harm. You also have the principle of do no harm. Plus, your do no harm is, your do no harm is the principle of non-maleficence. Okay, I would like to write that again. Do no harm, that's the principle of non-maleficence. Okay, plus maleficence, di ba? Mali is bad or evil. Beneficence, benigno. Benigno is good. That's the meaning, class, of your beneficence and your beneficence. Okay. Now, happiness. There's one more thing, class, about happiness. No. Okay. It's not always the happiness of one individual, but in cases, class, for example, of the pandemic, or in cases, for example, of mass casualty. When I say, class, mass casualty, halimbawa, no, there's one jeepney, for example, who had an accident, and then it involves 30 individuals. Okay, so you need to think of the greater good of the greater number of people. Plus, the greater good of the greater number of people is referred to as utilitarianism. The greater good of the greater number of people, that is utilitarianism. Why am I giving this as an example? Look at the pandemic, guys. Look at the pandemic. During the first months of the pandemic, no? During the first months, picture it during March, April, May. If you will be quarantined, are people happy to be quarantined? Diba, no? Diba? People are like, why would I be quarantined for 2 weeks? I would want to go out. I would want to enjoy my life for 2 weeks. But remember, we are not only thinking with one individual or for one individual. We are actually thinking of the greater good, you write there, greater good of the greater number of people. Okay, so greater good of the greater number of people. What we're applying there is the principle of utilitarianism. So do not misconstrue it. For example, you have seen there, ay happiness daw hambal ni sir. So meaning if the patient is not happy, I will not be able to do it. Okay, remember, it's always case-to-case basis. Because if you have not yet realized, no, our lessons in ethics is making us realize that there is no one concrete good in a certain instance. Okay, there is no one concrete good, okay, in one instance. So, halimbawa, no, again, I would like to repeat, during the pandemic, if you need to be quarantined, even if you are unhappy with it, okay, even if you are unhappy with it, you need to be quarantined because we are not only thinking of ourselves, we are also thinking of the many people around us. Next, to understand the moral goodness, we need to study the soul of man because one does not grow in true understanding if the soul is unknown. Okay? Plus, in the past kasi, they usually refer to it as soul, no? Diba, the argument in the past is that is the mind the same as the soul? If you've learned philosophy of man, diba? Amo nang focus sa mga philosophers natin to determine whether the mind is actually different from the soul. Now, what do we actually what do we actually mean here by the word soul? Plus, this actually refers to your attitude. Your soul actually refers to your internal values. Okay, it actually refers to your internal values and even your virtues. Okay, so what does it mean? Plus, to understand moral goodness, we need to study the inner soul of the man because we could not understand it without understanding one. Okay. Now, yesterday I was looking at the internet, and then there was a post in Facebook that was posting a picture of a certain guy 8 hours before he committed suicide, and the picture depicts a guy who is very happy and laughing. I think the main message there was that it's telling us that even if somebody is laughing right now, it does not mean that he is not going through something. Okay, and I think the message is loud. Even if you are dealing with your patients, guys, you do not just look at your patients the way they appear. Okay, you need to look at the inner side of your patient, not remove the clothes of your patient. But what I meant is understand where your patients are coming from. You need to understand where your patients are coming from. Now look at this, for example, a patient who would not go to the hospital. Allow me to give you a case now so that you might be able to understand. Let's say, for example, a 70 female. You've noticed that this 70 female has skin infection. This patient class needs to be admitted. Needs to be admitted. However, class, the patient is refusing admission. The patient is saying, I don't want to be admitted. And here comes you as a nurse. No, ma'am, dapat ma-admit ka. Kailangan talaga ma-admit ka. Parang angry ka ba talaga? No? Ma'am, kailangan talagang ma-admit ka because it is what is needed. No? It is what is needed. Now, class, during interview, you would come to realize that the woman does not want to be admitted because she is still taking care of her husband. Or during the interview, you would realize that the woman class would not want to be admitted because there are matters at home that could not be handled by other people. Okay? So do not right away jump into conclusion. No? Kadalasan kasi, class, what's the tendency? No? I would not tell you that I am not guilty of this because this oftentimes happens. No? It oftentimes happens, and then I would realize na, okay, we should have realized it, we should have interviewed the patient deeper. Oftentimes kasi, for example, the patient would refuse admission and you are like, ma'am, pumunta ka pa sa hospital kung hindi ka man lang magpa-admit. Diba? That's sometimes the reaction that we commonly have. But you need to realize that we are coming from different souls. We are coming from different experiences. We are coming from different priorities. Okay? So rather than be getting mad at your patient for not listening to you, you need to understand where your patient is coming from. Now, if your patient class would refuse admission, one thing that you could possibly do, inform the doctor. Okay, plus the doctor might find means. For example, the doctor would say, the doctor would talk to the patient, and then, for example, the doctor will apprise the patient. Like the doctor will be able to tell the patient that, ma'am, it's possible for you to have an IV line. Okay, IV line class, the dextrose that you commonly say. And then, ma'am, you can go back to the hospital twice a day just for your medications to be administered. Let's see if there will be improvement after 3 days. If there will be improvement after 3 days, there's no need for you to be admitted. But if there will be no improvement after 3 days, you really need to be admitted. You get, class, the example or the approach that I am telling you. So we ought not to be hard to our patients because they're also going through something. Okay? They're also going through something. Here's a very particular example that you will see in the ER. In the ER class, if there is a child that gets to be admitted, you know what happens? Sige nga, who do you think is the pinakamakulit na tao once a child will get admitted? Is it the child or the mother? Is it the child or the mother?
The mother.
Guys, the mother. Now, what would happen? Every 5 minutes, the mother would be telling you, nurse, okay na ang laboratories? Nurse, okay na ang bulong? Have you given the medication already? Some of you are smiling because you are reminded also by your mothers, right? And then your mothers would like say, nurse, naka-take na siya ng drug. Nurse, pwede bang pwedeng mag-TSB? Nurse, pwede bang mag-IV? Nurse, lahat na lang, no? Everything they would be calling you. Now, if you would try to understand why the mother is acting like that, because the mother is actually feeling guilty, the mother is actually taking responsibility for the sickness or illness that the child had. You get the point? No? So oftentimes, kung ikaw naman na nurse na stress, anong usual reaction mo? Ma'am, kalma nga muna ang busy ko. Okay? So oftentimes that happens. That happens. But since you're learning ethics, you know that you should approach these patients and folks or parents calmly because they are actually getting guilty for themselves. They are actually guilty for themselves. Okay? So that's why you can tell them, ma'am, I understand that you might be anxious, but please sit down. We are attending to your patient. Okay? We are attending to your patient. Things like that. No? That's understanding the soul of man. Now, another thing. The content of moral goodness passes through reason and will. and the mark of goodness passes rationality among different people, places, and cultures. I would like to re-emphasize 3 words there. You have reason, will, and then another one, rationality. Reason, will, rationality. Look at those 3 words. What does it imply? Does it imply that it's conscious or unconscious? Does it imply it to be conscious or unconscious?
Conscious.
Conscious, sir.
Conscious, no? Conscious. So class, the moral goodness ought to be conscious. In other words, there's a reason behind why we are doing it. It is my will to do it. And as rational beings, when I say rational beings, we are beings of reason. There is a reason why we do that, why we do things. It goes back to reason, consciousness. So class, when I say moral goodness, it passes through reason, will, and rationality. Okay? For example, if Diane here would say, "Sir, for me, what is morally good is this." I could not tell Diane and then say, "No, Diane, this is what is good." Okay? Instead, I would talk to Diane. "Diane, what made you think that that is good? Could you share your ideas? What were your experiences in the past that made you think that this is good?" Okay? That's for you, class, to understand your patient. Later on, you will encounter hard-headed patients, and for you to address them, you need to understand where they are coming from. Okay? Look at this, for example. No? Look at patients in the dialysis. I have had a lot of patients in dialysis who are undergoing class dialysis because when I say class dialysis, what part of the body is damaged? What part of the body is damaged?
Kidney.
Kidney. Okay, tama, kidney, no? Now, these patients, class, are undergoing dialysis because somebody advised them to take herbal capsule. Okay? Herbal capsule. Kung ano mang herbal capsule. Now, these patients are really difficult to educate. Why? You will tell them, "Sir, you need to stop the herbal capsule because its effect on the kidney is not yet well studied." No? As said, sir, on the advertisement, no approved therapeutic claims. Pero kung manotice nyo, di ba sa advertisement, ang bilis lang ng words na no approved therapeutic claims. No approved, parang kinakain na no approved therapeutic claims. Okay? Because that's the way they advertise it. Now, when you educate these patients, "Ma'am, please stop taking the herbal capsule because that might damage your kidney." They would not listen to you because they would believe Manang S, they would believe Aling S or Aling A who told them that the herbal capsule removed the bukol in their body. It removed the cancer in their body. Okay? So you need to understand where they are coming from for you to address them properly. Okay? Now, for example, if my patient will be like that, no? Some of my patients kasi will say, "Amalia nurse, I'm so sorry. But Manang told me, Manang is my friend who told me that herbal capsule could heal the cancer." My next question would be, "Ma'am, have you seen the results of the ultrasound or maybe the CT scan of Manang Inday who have given you the advice to take the herbal capsule?" Then they would say, "Nurse, wala ko man nakita." "Are you sure, ma'am, that he had cancer? Are you sure, ma'am, that she had cancer before?" Hambal yung hambal Manila. Okay? That way, class, you're trying to instill doubt already to them. But if you would notice, if sa una-una pa lang, I fought her and then I told her na, "Ma'am, you're wrong." Okay? By that time, class, when you disagree with your patient, the tendency is that they will resist. Try your friends, guys. If you will disagree with your friends, oftentimes they would resist. Now, for example, Diane and I, for example, are friends, and I will tell them, "No, Diane, you're wrong." What's the tendency of Diane? Diane would become defensive. Diba? Have you observed that? Okay, that's also the same thing when you are dealing with your patient. So class, to address reason, to address will, and to address rationality, you need again to go back. What is the reason why they are having this behavior? Okay, you need to go back. What is the reason why they are having this behavior? Okay, kindly take note of that. Now, what else? Now, plus moral goodness must be contextualized in different times and places. Hence, there is a need to study different cultures, histories, and cases to understand the core of the moral goodness at the time and space. That's a long sentence. The word there that I would highlight is culture. Culture. An example that I might have given already is abortion. Abortion in the Philippines, acceptable or not?
Not.
Not.
A big no-no, no? A big no-no. Or for example, you try to say, hey, mapa-abort ta karon. Magpa-abort tayo mamaya, and people will be looking at you. What kind of devil are you looking at? Are you talking about? What kind of evil are you planning about? Because in the Philippines, it's not acceptable for us to do abortion. But if you would look at Western countries, no? Western countries, particularly US, for example, they would say, I would want abortion because I don't think that I can handle my child. I don't think that I will be able to make my child grow. They can go to an abortion clinic. They can go to a maternal doctor and then it would be addressed. But in the Philippine setting, guys, no, even legally, for example, now if somebody would ask you, hey, Cherise, Carmela, I would want to be aborted. Okay, could you help me? If you will assist that individual, you are also legally liable if what will happen to her. For example, Marco here would already have his license. I'm a doctor, for example, and then I will tell, Marco, come here. I will give you 10,000 pesos. Please be my nurse during the abortion. Marco should know that abortion is still illegal in the Philippines. If he will be doing that, he will be losing his license. Okay? That's not only an ethical issue, but that's also a legal issue. Then plus, if you would look at your theories in nursing, that would go back actually to the theory of your Madeline. What's the apelyido of Madeline? What's the last name of Madeline?
Lining nursing.
Okay, so Madeline Leininger. Okay, so class, your Madeline Leininger, the theory is on the transcultural nursing. Madeline Leininger tells us that, okay, it's not one factor. It's not a single factor that affects the care that we deliver, but the culture of the patients. Okay, the culture of the patient. For example, here in the Philippines, therapeutic touch is okay, di ba? I told you earlier, you could touch the arm of your patient and say, Ma'am, I am here. I am willing to listen to you. Now, do that to a Japanese patient, and the Japanese patient might think that you are sexually advancing something. Okay? So you need to be careful with the cultures. Huh? That's why it says here, you need to study cultures. Eye-to-eye contact. Here in the Philippine setting, for example, I'm discussing and then I'm looking at my cell phones. Some of you would think, nah, he is not focusing in his class. Okay? He is not focusing in his class. Diba? Pero class, so you would want eye-to-eye contact, no? Kahit pa paano you would want eye-to-eye contact because that would make you think that you're focused. For example, your boyfriend and girlfriend. We're talking and then you're not looking at me. Okay? Break. Okay? Diba? We value eye-to-eye contact. But in other cultures, they might think that you are aggressive if you're doing eye-to-eye contact. Okay? Parang naghahanap ka ng away if you will be doing eye-to-eye contact. So it says here that moral goodness is different in different times, in different places. In other words, what might be good in the past might not already be good at the present. What may be good in the present might not already be good in the future. The same applies in our medications. For example, right now, we are recommending medication A for COVID-19. Now, 3 years from now, who knows, people would find out, medication A has a side effect. Let's not use it anymore for COVID-19. Let's use a new medication, medication B. Okay, that happens. That happens. So, wag matigas ang ulo. That's the key message. Wag matigas ang ulo. And when you are in other countries, guys, you need to understand first the culture of these people before you would push them, the nursing interventions that you will be doing. And then other than that, your moral goodness is described in terms of honorable good, useful good, and pleasurable good. The language and classification of these goods are actually based on the natural movements of man's dynamic appetite. Okay? Now, it says there, dynamic appetite. So there comes a time wherein I will be doing the honorable good. There will come a time that I need to do the useful good. There will become a time that we will prioritize the pleasurable good because it depends on our appetite. That's not your appetite, guys, in terms of you would want to eat. Okay, that's not the appetite that what we meant. Okay, it means that the usual stimuli, okay, that the usual drive that you would want to fulfill as a man. Okay, I will be discussing the next topics now on the succeeding discussion.